I think that occupational health is a subset of public health, which is intrinsically or inherently an activity which benefits the disadvantaged. Not exclusively, but it's the only set of resources that are directed to the disadvantaged. And the reason being that in occupational health, the government often looks to the private sector and says, this is your business, you sort it out, the health of workers. And of course that doesn't happen because there's a contradiction between profit and these sort of activities are often seen to detract from profit. So I think that is the short answer, is that all of the work that I've been involved with is with identifying hazards and problems for working populations who are typically disadvantaged, especially in a country like South Africa, and perhaps in a small way proposing some solutions or interventions that might be to their benefit.
A lot of research effort between local authorities, courageous local authorities, the CSIR and the University of Cape Town, our group here at UCT in particular, we're working on looking for bacteria that could do biological phosphorus removal. And a technology eventually was developed around these organisms that can do that, and that for the first time allowed sewage treatment plant effluents to have both nitrogen and phosphorus removal without chemical addition, therefore allowing sewage treatment plant effluents to be returned back to the river courses and mitigate the eutrophication problem that we were getting in many of our dams.
Started off working on research to do with pesticides amongst farm workers, and the problem there was that farm workers at that stage were very poorly protected by labour legislation, very poorly protected by measures that were in place on farms in the region, and they really had very little awareness of the problem. So our research focused on some of the long-term chronic health effects of pesticides, and we also examined some of the contextual factors that increase risk for farm workers.
We conducted a client needs survey on behalf of Abalini Bezekaya, which was and remains an initiative which provided training in food gardens. And we did this client needs survey on behalf of the communities of Nyanga and Kailicha. This enabled them to provide a more targeted service to those poor communities.
Well, we started our research in 1995, which was just after the end of the apartheid era, and there was a tremendous amount of suspicion about white researchers going into black communities, getting their data and then disappearing and actually making no difference. And from the beginning, we took an attitude of we had to build capacity and we had to build understanding and build relationships.
We built up a huge database of information about the last million years in the Western Cape. We thought we understood to some extent how people had lived there over those many thousands, hundreds of thousands of years. And we wanted to share this with the community. And it seemed to me that these were not separate activities. It was our responsibility to do the research and turn the research into interesting information, useful information for the local community. It was all part of the same project.
You know, we live in a society which has very high poverty and very high inequality. Policymakers are grappling with this, and in the late 1990s there wasn't a strong evidential base. There wasn't a lot of evidence. We didn't have a good understanding of where poverty and inequality had come from. Now this was both an extraordinary opportunity for young scholars to do research on these pressing social issues which would inform public policy. So it's a great opportunity, but with that opportunity came responsibility. That really, as scholars, that we really have a responsibility to draw on the resources of the university to try and understand these pressing social problems, to try and cut through the kind of the conventional wisdoms very often and the entrenched political positions that different vested interests bring to the table, and to actually to try and to contribute to policy making in that way.
And we're still doing it, of course. Our current work is pretty much in the same vein as it was back then.
Yep, poverty and inequality are still there, and scholars are still working on them.
And policymakers are still fighting with us.
That's right.
The social responsiveness of Sandra Burman's research, and she was primarily a researcher more than a teacher of academic law, is to be seen, I think, in two ways, in form and in substance. It started with form because in many ways that was the more important part of her work. She returned to this country in the 1980s, having spent the previous 15 years in Oxford, where she was close to the socio-legal research movement. And she brought the methodology and the interest and the objectives of socio-legal research back to this country and really pioneered it in a remarkable way.
The award was really for our work for a book called Fighting Poverty, which was published in the around 2000 as a result of sustained work we did on South African survey data to do international analysis, international quality analysis on those key issues of poverty, inequality, and labour markets, and particularly the relationship between the labour market and the reproduction of poverty and inequality in South Africa.
So, I mean, part of what that research did was to, I think, define a way in which the society and perhaps policymakers started to think about the measurement of poverty and inequality. So for me, that was the one key impact, is that senior policymakers realized that they could not proceed on a program of poverty alleviation or inequality reduction without decent data, and next to that, analytical work on the data. And the second thing it's done is any new, I think, serious policy program that the state has embarked on, be it the child support grant or minimum wage, that has always begun with the question of, well, where can we get the data and who can do the analytical work and the rigorous policy work before we actually proceed to policy formulation.
I started working with the late great Kader Asmal on issues of religion education, on social cohesion, and then one day he wanted to give a book to Nelson Mandela for his 85th birthday, and that was 6 weeks out, and we managed to produce this great book, Nelson Mandela from Freedom to the Future, which I think is really a landmark text for the legacy of Nelson Mandela and promise for the future.
Alan Fleishman was really a giant in the area of child and adolescent psychiatry in Africa, as well as in public mental health. He was our first chair, Sue Stringman Chair of Child and Adolescent Psychiatry, and this is really an important area and the only such chair in Africa, so it was very significant for us. In the area of public mental health, he was a pioneer locally, and today we have the Alan Fleishman Center for Public Mental Health, which is doing groundbreaking work.
So winning the Alan Pifer Award in 2006 enabled me and gave me the encouragement to continue working in this village of Volzoek, where I was able to document, and I still work there today, over a very long period, from 1995 to the present, the changes that happened from the apartheid years to the post-apartheid years, changes in governance, changes in the economics, changes in local people's livelihoods, and changes in land use. I was able to document, and have been able to document, all these things that have been going on in this community over more than 20 years now.
It involves a week of workshops in which students explore, school children explore through art and drama and performance a Black and Lloyd story from the Black and Lloyd archive. And they interpret it in ways that are multidisciplinary. And the first time we did it, at the end of the week, there's a performance that Mark and his interns and trainees facilitate. And in that parade, lantern parade, the children carrying their little lights, the church band at the head of the parade start marching through the little town. The sun starts to set, the sky deepens, it becomes this deep blue, and then by contrast these beautiful, warm, glowing lanterns. And they sort of snake through the little town, and people started coming out of the houses, pouring into the procession, and became transformed by how beautiful it was, how gorgeous it looked, how magical it was, and they sort of gasped with the beauty and the loveliness of it. And in fact, it's something that takes people's breath away when they see it. So after the week of all this workshopping and making. This then becomes the transforming act of art, and the whole project is facilitated by that in some sense.
And now we've done it for 15 years. The project has become really embedded in that community. It's really a part of the annual calendar of events for that particular community.
So my research actually involved looking at a genetic predisposition to colorectal cancer, which is a lethal condition, in a pocket of individuals in the far northern Cape. So my role as a molecular geneticist was to attempt to identify what at the molecular or genetic level do each of these affected individuals carry that might predispose their descendants or children inheriting that particular condition. So the work eventually was successful, and what we were able to do is to develop a genetic test that we can quickly apply to individuals who are not yet affected. And in doing this, we found a whole string of people along here, in fact communities of folk, who were carrying this genetic change and therefore predisposed to this kind of colorectal cancer. So now we go in early, we're able to screen individuals who are carrying the mutation, put them in line for good surveillance programs, and in fact prevent them from getting the disease and dying from it.
We undertook the first nationally representative study of common mental disorders in Africa, and that's really provided us a lot of information about how prevalent these conditions are and also about how disabling they are. It turns out, for example, that mental disorders are more disabling than physical disorders, and yet much less money is given for mental health services in comparison.
One of the things which makes my work socially responsive, which is perhaps a little different from other people's, is that I don't work directly with communities, not in a face-to-face, body-to-body way. But what I'm interested in is how cities change, and so my work looks at the institutions and the policies and the implementation that affect poor people's lives very, very directly in the city, and through research to try and understand what has to change, how it can be changed in ways that maximize the impact on the poor. And hopefully that lasts not just for this generation, but also for subsequent generations, and gets fixed in the built environment and how the city feels and works. So, yeah, different version of social responsiveness.
So I received the Alan Pifer Award in recognition of contributions to addressing the health challenges of the African population, specifically looking for potential cures that address diseases that disproportionately affect the African population. This work typically involves integrating multiple disciplines that come together, including interactions with clinicians to understand what the unmet medical need in terms of what the patient requires in the field.
My work has focused on respiratory diseases in South Africa. Diseases of the lung are a very important cause of morbidity and of death. Our approach has been to understand their epidemiology, how common they are, to look at new treatments. But perhaps the greatest impact has been in two areas. Firstly, in the way we view and treat asthma. And worldwide, the approach that we adopted and researched from here has been accepted in international guidelines. Secondly, has been our focus on integrated care for chronic diseases and infectious diseases in South Africa. And here too, we've been able to take a lead in researching ways of improving quality of care, particularly that delivered by nurses or frontline clinicians in primary care facilities.
Mental health is a neglected issue in health policy and in development policy, especially in low and middle income countries. And the main impact of my research has been on taking up research for cost-effective interventions into mental health policy frameworks, especially using the evidence for the links between poverty and mental health, and showing that cost-effective interventions actually have an impact not only on the mental health of vulnerable individuals, but can have social and economic benefits as well.
I think probably the impact that has been greatest has been the work around the introduction of antiretrovirals to the community. And we've seen in the last 15 years the wonderful results of that. We've seen an increase in the longevity of South Africans in general, but also we see an extraordinary turnaround in terms of hope and a way forward. The new conundrums that come out of that is really how to sustain that and also to prevent HIV, again in the very young South African population, where really I think our focus needs to be going forward.
Yes, tuberculosis has been a dreadful scourge of Cape Town for a long time. In fact, Cape Town was one of the first cities in the world to make TB notifiable, and it seems as though we've had a problem with TB for 100 years. So people in Cape Town have as much TB as the United States of America, UK, Canada and England put together. And part of our work is to try and find out why is that and what can we do in a new way, in an innovative way, to try and control that disease.